Hello everyone. Thank you so much for joining us today. Good evening semua. Apa khabar semua? My name is Dishan Kumar and thank you for joining us on the live webinar on Are You Binge Eating? You Might Have Anxiety. So, I nak intro I punya co-moderator hari ini, Dr. Sandra Raman, a general practitioner from Clinic Masuri 24 hours. Now with more than 632,000 followers on TikTok. So, siapa-siapa tak follow Dr. Sandra, pergi follow TikTok dia. Okay, she is known for her health-based content, explained brilliantly in a fun way, which teaches viewers about health and wellness issues. And also joining us today is our special guest, Dr. Amir Siddiq Amir Nordin. Dr. Amir Siddiq Amir Nordin is Associate Professor in Psychiatry, Director of Center of Community Engagement, UMCAS, and the Chief Coordinator for University Malaya Center for Addiction Sciences in University Malaya. Doctor, thank you so much for joining us today.
Hi, both of you. Sorry, I don't have 632,000 followers on TikTok.
Supposedly 633, Dishan saja je. Okay.
Oh my God, I'm sorry, I missed 1,000 people
kurang
there.
1,000.
No, they unfollowed me because I think not active.
Okay, so guys, today's topic is Are you binge eating? You might have anxiety. So to start off this topic today, let's talk about anxiety. Dr. Amir, what is actually anxiety?
So I think first of all, anxiety often is mistaken with stress, or there's a lot of correlation between the two. Often the symptoms are about the same. So basically it is the ability to, or the reaction of...
Oops.
What happened
Sorry.
there, Dr. Sandra?
Yeah, okay, can continue. Okay, continue.
You're not doing your TikTok yet, yeah? Belum lagi.
What's going on? Why?
Yeah, the connection.
I think it was
okay.
a bit of a lagging just now. So basically, anxiety is going to be, a situation where you've got these physical symptoms, psychological symptoms that happen to individuals, often due to this feeling of a loss of control. So the physical symptoms are going to be things like sweating, palpitations, or your heart beating quite quickly. You might feel a bit lightheaded, butterflies in the stomach. And then if you're talking about the psychological symptoms, individual will be feeling fearful, often scared, sometimes anxious, as one would feel.
Takut, nervous, and
yeah. And normally this is going to be a result of a situation which often it's either it's real or unreal, that they feel that they're out of control. So again, it's really important for us to know that anxiety itself is actually normal. It's actually one of our responses, what we call a fight and flight response, prior to sort of helping us to protect ourselves from danger. So kalau dulu-dulu tu, we often have anxiety when we are faced with certain levels of danger. For example, a tiger in front of us, or dalam sekarang ni mungkin nampak ular ke ataupun cicak tiba-tiba ke depan kan. So we get a bit anxious. So we're ready to run, So masa itu biasanya our system is actually at its sort of engaged in order for us to be able to flee. So an individual that has, for example, problems, this is where it becomes the discussion that we're talking about kan, disorder tu. Disorder means that these symptoms that we were talking about, that is supposed to be normal for certain individuals, becomes a bit more excessive. Often it becomes in a situation which is not in context. There's nothing in front of us. There's no fearful or things that we're ready to run. However, our body has suddenly decided that it wants to go into that zone, and we are unable to function. I think that's the most important thing. That as a result of these symptoms that we are talking about, the person is unable to function. Therefore, at that point of time, that person is said to have a disorder, a problem. And often, masa tu lah, either he or she feels that they've got to do something about it. So that at that point of time, either they see myself, or they might be pushed to see Sandra first, often Dr. Sandra first, with these symptoms. And then she has to decide what to do with these symptoms that these people come with.
Okay, so basically what Doctor is saying is anxiety is normal. To have anxiety is normal. Everybody has anxiety. Semua orang pun nervous. Semua orang sebelum interview nervous ke, sebelum I buat webinar ni I nervous. Being nervous is
Betul.
normal,
Very
okay?
true, very true. Being anxious lah, being anxious and nervous is very very normal, very
Yeah.
normal. Tapi the thing is that bila dia jadi bermasalah, because bila kita anxious
Okay, I think Dr. Sandra's line is bad. It's okay. Let's maybe move on. It's just when the things
like Dr. Amri kata tadi, kita tak
go bad. Dr. Sandra? Sorry. Okay, sorry. So Dr. Amir, okay. So basically is bila orang tu tak boleh berfungsi seperti biasa, that's when it's become something more serious, kan? They
Yeah.
cannot do their daily things. It just becomes something macam dorang, that becomes a very big thing for them. Dorang tak boleh function as a normal person lah. Okay.
Yeah.
Now, what are the symptoms, if you want to talk about like anxiety disorder, what are the symptoms?
So as I shared with you just now, the symptoms will manifest itself both physically and also psychologically. Yeah. So
Okay.
physical symptoms, often if you're talking from top to bottom, we will have, for example, maybe headache, lightheadedness, maybe sweating. Maybe at that point, some people even have a bit of blurred vision. They might feel that their hands are a bit trembling. It might be full tremble, or they just might have that feeling of palpitation. They might have shortness of breath or rapid breathing. They might have feeling of queasiness in their tummy where they feel like they nak pergi toilet je contohnya. They might have a bit of incontinence. So these are often the physical symptoms that individuals get as a result of the anxiety. And sometimes they might even feel cold and clammy, or they might actually feel very hot. And this is often, like I said just now, that anticipation to actually run or do something about it. At the same time, they might also have psychological or emotional symptoms. And often this is going to be things like what you mentioned just now, Dishan, this feeling of nervousness, this feeling of fear maybe for some individuals, rasa takut tu, this feeling of anxiety, tak senang duduk contohnya, that feeling. So these are psychological anxiety symptoms that some individuals might face. So normally it's a combination of both. And often, as I've shared with you before, if it's going to be anxiety per se, it's because there's a certain threat. Like what you just mentioned just now, maybe this individual is going for an interview and he's, he really or she really wants that particular job and he wants to really do well, but he doesn't know what to anticipate. This is where we said about that loss of control too. He's unable to anticipate what is expected of him. Of course, if he is very well prepared, there's no anxiety. But if you're not well prepared, or partially prepared, or you're just unable to predict what's going to happen, contohnya, then you're going to have quite a bit of the anxiety. So some individuals, they will have excessive amount of symptoms that will then be problematic for them.
Okay. If we want to talk about, so these symptoms and everything, is it because of a trigger? Like if I think about the interview now, I'm much nervous and everything, I have all this. Or is it something that is continuous? Like, is it something that is only triggered when I think about things, or is it something that is very continuous?
Yep. So if you're talking about just general anxiety symptoms, then often there's going to be a trigger. Often, yeah. As exactly as you mentioned, it could be, it could be real in front of you, or it could be imagined in the sense that you're thinking about it. But often there's going to be certain reasons why individuals get anxious, and often it's going to be related to a bit of experience as well. However, for those who have a disorder, ada masalah ataupun masalah kesihatan dari segi isu kegelisahan ni, then it's totally different. Often there is no trigger for some of them. Most oftentimes than not, the duration is much longer than anticipated. Biasanya kita rasa takut masa kita ada dihadapi dengan isu tersebut, itu normal lah. Kan, macam Dishan kata tadi, nak pergi interview, rasa nak sangat kerja tu tapi tak tahu apa nak expect, rasa risau sikit, biasa, itu normal. Tapi masalah dengan orang yang ada masalah kesihatan, anxiety ni, isu tu dah tak ada tapi dia masih lagi rasa takut sedemikian, berpanjangan, dan kadang-kadang berbulan-bulan ataupun bertahun-tahun, sampai menyebabkan individu itu tak dapat berfungsi. Mungkin dari segi dia punya kerja sebagai seorang individu, mungkin sebagai seorang bapa ataupun anak contohnya, ataupun sebagai seorang pekerja. So dia dah tak boleh lagi menjaga dia punya fungsi, maka pada masa itulah dikatakan dia ada masalah. So often at that point of time, not only do you not have the trigger in front of you, you have symptoms that are long duration, and more importantly, it starts to cause a chips in to your daily function where you're just unable to do anything. You're incapacitated by these symptoms that often would be normal for certain individuals.
In fact, benda biasa pun, like nak masak ke, just nak pergi kerja ke, or just to go to grocery shop tu, macam tu, memang tak boleh. So you cannot perform very very simple task. Itu yang Dr. Amir cuba nak bagi tahu kalau anda ada anxiety, okay? So kira macam you nak pergi hantar anak ke sekolah, terus you jadi takut, okay? You tak boleh nak keluar rumah pun. Sometimes ada yang teruk sangat sampai tak boleh nak keluar rumah, okay? Benda tu tak jadi, okay, tapi you all still fikirkan benda tu akan jadi juga. Kalau saya hantar anak saya pergi sekolah, saya lagi kena culik. Okay, you dah dengar kes culik tapi you over anxious daripada orang yang lain. So orang lain ada anxious, lepas tu you ada anxiety disorder. So macam mana you guys nak tahu betul ke tak bila you dah mula rasa benda ni mengganggu dah saya ni, saya tak boleh nak perform normal things that biasanya saya buat. So anda kena ke doktor yang terdekat, biasanya kita kata family medicine doctor macam saya kalau swasta, ataupun kalau government kita kena jumpa doktor klinik kesihatan dulu. Tak boleh straight pergi jumpa Dr. Amir terus. Dia big boss tu. Okay. So kami akan assess anda dulu, okay? First of all, kami kena pastikan anda tak ada masalah kesihatan yang lain yang mungkinlah nampak macam anxiety ke, nampak macam you panic ke, jadi berdebar-debar. Sebab anxiety ni dia akan berdebar, you akan rasa macam berpeluh. Tiba-tiba, okay, patient sometimes kalau tak tahu simptom pun susah juga. Dia akan rasa macam tangan dia kebas. Tangan sebelah kiri ke, tangan sebelah kanan ke, lepas tu rasa macam demam, seram sejuk, especially malam, padahal tak demam pun. Okay, suhu normal je. Okay, duk makan Panadol non-stop. So kita kena check anda dulu. Okay, make sure semua okay, anda sihat, alright, and then baru kita akan proceed untuk kita kata buat some test, okay, like some questions, kita kata DASS scoring untuk check anda ada ke tak stress ke, depression ke, anxiety ke. Sebab yang ni semua dia berkaitan rapat, okay? Stress, anxiety dengan depression ni dia berkaitan. So kita kena pastikan slow dulu. Tapi kena jumpa doktor dululah. So lepas ni kita bincangkan macam mana kita nak buat diagnosis. Dr. Amir?
Okay.
Yeah, so macam what Sandra has mentioned just now is actually correct. Normally, people that have symptoms, often we're going to be looking out for certain other conditions that might mimic these particular these conditions. So I think before we actually go to the how do you make a diagnosis, first of all we've got to understand that there are a number of anxiety disorders out there. Yeah,
okay.
Ada beberapa, dia bukan saja satu blanket. Secara keseluruhan payung dia tu is anxiety disorders. Tapi di dalam tu ada macam-macam jenis masalah kegelisahan. Yang biasa kita dengar adalah masalah fobia, ya. Yang ataupun anxiety tertentu pada target yang tertentu. Yang kedua yang sering kita mungkin dengar adalah penyakit panik ataupun panic disorder. Yang ketiga mungkin something called generalized anxiety disorder ataupun kegelisahan umum biasanya dipanggil, ya. Keempat mungkin kita pernah dengar post traumatic stress disorder ataupun pasca trauma. Yang kelima mungkin dulu dikatakan bahawa obsessive compulsive disorder juga di dalam kategori anxiety disorder, tapi sekarang dia dah jadi satu kluster dia sendiri. So yang keenam adalah social anxiety disorder ataupun kegelisahan sosial, ya. So inilah beberapa simptom-simptom beberapa jenis-jenis penyakit anxiety yang ada di luar sana. So macam mana kita nak buat diagnosis tu, biasanya dia melibatkan sama ada simptom tu lebih kepada kegelisahan, kemurungan ataupun isu lain seperti psikosis. So kalau anda ada simptom-simptom yang kita bincangkan tadi tu, yang Dr. Sandra pun dah jelaskan dengan lebih jelas lah, where she talked about things like, anxious feelings, sweating, feeling numbness, for example, that comes and goes and is often there for long periods of time.
Yeah,
then it's more likely than not individuals are having an anxiety issue. Yeah. So then we need to find out whether there is a trigger or no trigger. If it is a specific trigger, then it could be a phobia. If there's no trigger, then it could be general. If it's suddenly happening out of the blue and causes individuals to be incapacitated, that person might be having a panic attack. And if you have multiple panic attacks, then that could be a panic disorder. If it's very triggered by the fact that you see people, that you're conscious about people around you, then it could be something called social anxiety. And of course, if it happens as a result of trauma, where you're unable to move on as a result of that particular traumatic event, then we might say that you might have post-traumatic stress. So these are the ways that individuals can identify a little bit about what types of anxiety disorder. So what makes it more important is the duration. Often these particular symptoms will be there for 6 months or even more. And even more important is that you're going to have an effect towards your work, towards your living arrangements, where you're just unable to function. So when that happens, you have a disorder, and this is where you'd probably want to seek help and hopefully seek help early.
Okay. To all our participant guys, if you have any questions, please letak dekat kita punya chat box, bukan Q&A If any questions for Dr. Amir, for Dr. Sandra and for me, please letak dekat chat box, okay? So before we go on, sebenarnya nak tanya kita punya participant, how many of you guys have had a panic attack? How many participant kita yang tengah tengok sekarang ni, you guys pernah ada tak panic attack? Macam Dr. Amir explain tadi. So if you guys ada, masuk dekat chat tu panic attack. So we want to know sebenarnya berapa orang sebenarnya suffering from this type of issue. Alright? So let's move on to the next topic, which is, I think we did how to make a diagnosis. Have we gone into more of that, Dr. Amir?
Not really. I think kalau kita kata when we come to kesihatan seorang manusia tu, kita ada organic dengan non-organic, okay? So kalau kita kata lihat ke bawah tu, kita kata non-organic lah, okay? Orang mata, everything means that mental health is non-organic, okay? Alright, yang lain adalah organic. So sometimes contoh thyroid, okay, pesakit yang ada thyroid problem, hypo ke, hyperthyroid ke ataupun combination, dia akan ada rasa berdebar. Okay, dia akan rasa berdebar, nadi dia laju, kadang-kadang dia pun rasa macam kita kata numbness, kebas-kebas macam tu. So that's why kita kena how to make a diagnosis tu, first tu kita kena buat full blood workout dulu. Okay, make sure you tak ada kencing manis, masalah thyroid, okay, darah tinggi, everything. Sebab kita juga pernah tengok patient yang dia selalu kebas, okay, bila kencing manis tinggi. Okay, nombor 2 darah tinggi pun, okay, 180, 280, kadang-kadang tangan kiri tu memang duk kebas semacam, okay. So kita kena work out yang ni semua dulu, pastikan benda tu tak ada masalah dari segi kesihatan badan ataupun fizikal kita dulu. Dah rule out benda tu, then baru kita akan kata okay, this is most probably showing towards mental health issues. Betul tak Dr. Amir?
Betul. I think thank you very much Sandra for actually mentioning that. Betul. Di mana kita kena pastikan bahawa kita ada masalah lain. So contohnya kalau kita nak kasihlah sedikit contoh rightly as you mentioned, kalau individu tu dia ada anxiety yang menyeluruh, generalized type of anxiety, kita kena pastikan bahawa mungkin bukan isu thyroid seperti Dr. Sandra katakan tadi. Kalau individu itu tiba-tiba rasa takut, cemas, kita dapat anxiety attack tu yang berkali-kali, kita kena pastikan bahawa dia tak ada penyakit jantung yang kadang-kadang juga boleh mimik simptom sebegini Kalau dia rasa macam perut dia memulas disebabkan oleh mungkin ada takut kepada kucing contohnya, fobia tertentu, kita pun nak kena pastikan bahawa dia tak ada masalah gastrik contohnya. So semua ini perlu dipastikan tak ada. Lepas tu biasanya Dr. Sandra dan kawan-kawan dia akan membuatkan penelitian tersebut. Dan apabila semua didapati memang negatif, baru mereka akan rujuk pesakit tersebut kepada saya. Kadang-kadang kita akan dapat pesakit itu datang terus kat saya, mungkin disebabkan oleh faktor-faktor tertentu, tetapi bila kita tahu dia tak pernah disaring, kita akan minta dia disaring kepada rakan-rakan kita di FMS atau Family Medical Specialist, ataupun mungkin pakar kesihatan yang lain seperti cardiologist ataupun general physician, sebelum kita betul-betul memikirkan isu anxiety tersebut. Kerana lebih penting adalah kita nak memastikan bahawa pesakit ataupun anda yang mungkin datang kat kita ni tidak ada penyakit yang kita boleh bantu dengan lebih cepat lagi. Contohnya lah macam tadi, kalau sakit jantung, kata panik, betul-betul kena heart attack yang mendalam lagi teruk. So we have to make sure that your heart is normal, but you're for some reason having these symptoms. Therefore, at that point of time, you might then be said to have an anxiety disorder.
Okay. So we have a few questions in the chat box. So kita punya participant guys, if you have questions, please ask. Kita akan jawab you punya soalan at the end of the webinar, alright? So tunggu. At the end, kita akan jawab you guys punya question. Okay, let's move on to coping mechanisms of this anxiety disorder. Dr. Amir?
Well, I think often individuals that have anxiety disorder pada permulaan dia tak tahu dia ada masalah anxiety disorder ni, dan dia akan cuba sedaya upaya untuk melakukan aktiviti-aktiviti yang mungkin dapat membantu, ya. So this is where contohnya ada yang makan berlebihan, comfort eating, tetapi mungkin dia sampai terlebih makan dengan cepat, sampai binge eating pun ada juga. So itu satu coping lah, cara dia nak menangani isu gelisah yang dia mungkin ada atau resah yang dia ada ni. Kedua ni mungkin dia menggunakan benda-benda yang terlarang, contohnya seperti alkohol ataupun nikotin, merokok dengan berlebihan disebabkan oleh rasa anxious sedemikian, mungkin ambil alkohol yang berlebihan juga boleh, ataupun mungkin dia mengambil sedikit pada permulaan, rasa tenang, maka dia belajar bahawa kalau aku ambil benda ni lagi rasa tenang, maka dia ambil tu berlebihan because dia berpanjangan simptomnya. Yang ketiga mungkin dari segi cara-cara lain yang dia melakukan untuk mengurangkan anxiety tersebut. Contohnya mungkin dia bersenam, satu cara yang positif untuk mengurangkan sedikit anxiety, ataupun dia terus avoid
biting nails,
ataupun dia terus avoid. Itu satu lagi cara, dia terus mengelak, dan yang macam Dishan katakan tadi itu, menggigit apa dia panggil, dia punya kuku tu pun satu lagi, ataupun yang kita pernah dengar dia tarik dia punya rambut pun ada juga, So dia antara beberapa cara yang mungkin pada permulaan tu dapatlah membantu sedikit dengan resah, tetapi kerana simptom ni berpanjangan, maka masalah lain yang akan terjadi disebabkan oleh coping mechanism seperti ini.
Okay.
So
Dr.
of course kita tahu juga, sorry.
Dr. Amir, just want to say, I actually read somewhere that as coping mechanism ni sebenarnya, when we do something and it makes us feel better, the brain releases a chemical, and that makes us want to do it more because we feel better. Is that true? Is that how it works?
Well, in the sense that the brain is dynamic, it doesn't want something that's negative. Something that's painful, something that's going to be traumatic. So if the way that you've managed to reduce some of the anxiety is such a way, then often the brain will say, repeat that again. And this is where we said that if it's a positive way that you started, then good for you, that's fine. But if it's a negative way that you started, then it's going to be detrimental for you in the long term if you continue doing it, even though it makes you feel better, but at the long term it's going to cause you more harm.
Okay.
Betul. Sebab macam biasa kalau saya dapat pesakit yang binge eating, kenapa kita kata tu, especially during before festival season lah. Okay, macam now is Christmas is coming up. Okay, I akan dapat the first these 2 weeks sebelum raya, sebelum Deepavali, kita akan dapat patients yang ada binge eating sebab contoh dia nak pergi festival. Dekat festival definitely got makcik bawang will ask them bila nak kahwin lah, bila you nak kurus lah, okay, and then after that all kind of other funny things lah. So when they jadi stress, mereka memang dah anxious dah, okay, maybe ada social anxiety, okay, tak boleh nak bergaul. Lepas tu bila pergi je dapat soalan yang pelik-pelik macam ni yang mereka tak comfortable. So before that they start eating, okay, they start already like 1 month before they start binge eating macam tu, okay. It gives them comfort, best what, okay, for a while makan nasi lemak, after that for a while makan ice cream, okay, you feel nice, you feel comfortable, but within a month sometimes weight gain, which also leads to obesity lah, okay. So one of the most common memang macam Dr. Amir kata, one of the most common memang is binge eating. Sebab tu kita bawakan topik hari ni. It gives you comfort, tapi lama kelamaan tu dia akan mengganggu kesihatan anda. Bila dapat obesity, dapatlah penyakit yang lain semua, kencing manis, darah tinggi, semua queue dekat belakang akan datang. So that's why it is not good to actually let yourself keep doing something that you think that benda tu comforting, tapi sebenarnya dia tak.
And even more so, Malaysian food very delicious. So
see,
even more tempting.
I eat nasi lemak every morning with sotong.
Okay, Dr. Amir, maybe we can talk about like now what can we do, types of treatment.
So again, once the diagnosis has been made, then often we will have a plan for you, and the plan often follows a framework which you call the biopsychosocial. Of course, now we talk about psychosocial lifestyle spiritual model, where we're looking at how do we handle your anxiety. So it really depends on the type of anxiety that you actually have. If the anxiety is, for example, phobia type, often we might start with talking therapies. There are certain types of talking therapies. Some of you might have heard of something like cognitive behavior therapy. This is a specific type that actually tries to assist you to get away from certain types of anxieties like phobia. Another that has been often mentioned is something called exposure response prevention therapy, which again also assists individuals with certain types of anxiety disorders. So there's certain types of anxiety disorders that this can be used. However, generally for the many of us, because of maybe cost and time constraint, certain medications might also be helpful in order to reduce the anxiety that you're having, and sometimes even remove the anxiety totally from the system. Because one of the what we call the etiology or the causes of anxiety could be a genetic cause, where certain individuals that have a certain predonsity ataupun a certain risk towards having anxiety disorder will have some dysregulation in certain types of chemicals in the brain. So once we use certain medications that might assist, therefore the anxiety is much reduced, and they're able to then move into recovery. So often these are the methods. Of course, at the same time, we talk about looking at the environment, because we know that anxiety disorders is going to be an interplay between your genetics and also the environment. Certain situations might need to be addressed, workplaces, for example, living arrangements. So again, we often try to assist you in making the better choices. And we know now from research that there's going to be two methods for you to prevent having an anxiety disorder, which has been evidence-based, cheap, and that you can do even right now. Number one is make sure that you have adequate sleep. So this is something that we're going to be assessing in you and making sure that you have adequate sleep. And of course, the second one is going to be exercise. Like Dishan had mentioned just now, there are certain chemicals in the brain that exercise actually releases. One of them is something called endorphin, which mimics something called dopamine that makes you feel a bit better. At the same time, it calms you down because you're also releasing serotonin. So serotonin is one of those neurochemicals in the brain that has been associated with anxiety. In fact, the medications that we give for you will be looking at boosting the serotonin. So one method that we can do it naturally is actually by exercising. So often we encourage you to exercise as well. And of course, as Dr. Sandra had mentioned just now, there's an interplay between anxiety, depression, and stress. So we know that if you're highly stressed, if you have depression, you're going to more likely than not have anxiety. So one of the other methods to also reduce some of that risk, which you probably need to do moving forward as part of your treatment, is something called self-care. So that comes under one aspect, and one of the interplays could be spiritual self-care that one could put into as well. So these are the various methods that we would encourage you to do. In fact, we would encourage you to do in stages. Tapi kalau you nak buat semua sekali boleh juga, tapi biasanya tidak overwhelm. So dalam fasa pemulihan tu, doktor-doktor ni akan cuba memberi nasihat supaya dapat dilaksanakan. Mungkin permulaan ubatan, lepas tu talking therapy, lepas tu baru digalakkan untuk exercise dan sebagainya, untuk pastikan supaya the anxiety disorder yang you ada ni, insyaAllah satu hilang, kedua tu tak datang balik.
Ya, memang betul. Okay. It is good, but you all kena ikut step yang Dr. Amir cakap tadi. Okay, jangan pula try untuk treat.
Okay. Sekejap, I think Dr. Sandra is lagging. It's
sendiri, okay, you terus jump. Okay.
Okay, Dr. Sandra is lagging. It's okay. So, Dr. Amir, I just wanted to ask based on your experience of giving these treatment options to people, let's say you suruh dorang ambil ubat dulu and then pergi talking therapy and everything, what is the response? Are people more inclined to, I tak nak makan ubat, I nak buat talking therapy, I tak nak ni, I nak tu? Is there a preference on the person also? Is that also important?
Yeah, that's really important. It's a really good question, Dishan. So often, kalau dulu-dulu tu kita kasih patient ambil je. Tapi sekarang ni, which I think is positive, patient are more informed. Lagi banyak forum-forum yang kita buat seperti ini, talks like this, discussions like this, patient becomes more informed about what's available out there, and they start to hopefully find the right treatment for them. So I think most people don't want to take medication. However, most people also come to see us with anxiety disorder, often in a very long stage. Bukan sebulan, 2 bulan yang kita galakkan dan harapkan, tetapi dia orang datang 6 bulan, setahun, 2 tahun, 3 tahun kemudian. Maknanya bila talk about the dysfunction, the dysfunction that they're having is really great, to the point that they are almost at the verge of losing their jobs. They are not going out of their houses, for example. They are literally incapacitated with this particular condition. So if you're going to do talking therapy, Dishan, it's going to take some time to actually start. There's a few factors. One is going to be the cost, because it's not cheap. Especially if you're going to do it in private. Yeah, if you do it in public, masalah kita tak banyak clinical psychologist. So duration menunggu tu lama. Yeah. So kalau do kat private, harga. Kedua tu, if you really want talking therapy to work, you need to have it weekly, at least at the very beginning. And how much of us have the time to go out weekly to get that treatment? Number three is going to be often when you do it weekly also, you really get the response maybe say in a month, maybe 2 months from then. It takes a little while because penyakit tu dah chronic, dah berbulan-bulan dah. So you don't expect the thing to suddenly heal by itself. So often these are going to be the limitations for the talking therapies. So at that point of time, when these patients are incapacitated, even though they might not want to take medications, after trying once or twice, they just can't wait anymore. Dah datang pun dah lambat, dah tahu apa penyakit tu. Bila dah dapat rawatan tak baik-baik pada permulaan, dia tak sabar dah. Saya pun rasa kalau saya kena penyakit seperti ini, saya pun tak sabar juga. Then the medications come into play. The medications have two types, Dishan. One is the immediate medication. There is what we call an acute medication that you give that will reduce your symptoms very quickly. So you feel actually much calmer. And then at the same time, these are symptomatic treatments. At the same time, there's going to be another medication that we often give which really treats the core, pada asal usul itu. The issue that we talked about just now, that imbalance in certain chemicals. So yang itu dia lambat sikit. So bila kita gabungkan, then the patient feels much more comfortable. And my personal and professional opinion and experience has been that if you are able to control your symptoms early, then when you do your talking therapy, it is more rewarding and fruitful. You pun seronok nak buat talking therapy tu, because your talking therapy tu adalah satu skill yang you boleh ambil dan teruskan kemudian. Ubat tu insyaAllah kita cuba berhentikan pada satu peringkat. Tetapi yang talking therapy tu mungkin dia akan berterusan. So at that point of time, these individuals are able to enjoy further this particular therapy. Kalau you letak talking therapy dulu, you just imagine you are incapacitated by the symptom. I don't think you'll be enjoying your talking therapy.
Yeah.
And you probably abandon it as well. Yeah, you probably abandon it, and you probably don't want to go there again, because like we discussed this now, this is something that's unpleasant. It doesn't seem to work for you, but evidence says that it does work, and therefore, you probably are not going to get the best outcome from that. So this is the kind of methods that we actually often do. Personally, for me, Dishan, I give the patient a choice. I give them an opportunity to trial what they feel that they want, but more often than not, because of the gravity of this situation, they will come back and say, Doc, that medication that you told me at the very beginning, where is it? I think I want it right now.
So usually they go back. Yeah, usually they go back to the medication. Okay. Another thing, doctor, sebenarnya kalau kita ada anxiety, any issues lah, and specifically talking about how Malaysians are, how important is it to have a support system? So all these people that come to you and talk to you and everything, how do they, is it macam diorang punya family, there's something wrong with him, we bring him, or we bring her, there's something wrong with her? Is it more of the family getting involved, or is it more of these people who suffer anxiety, they're actually very alone, and hence why they have depression and anxiety and things like that, based on your cases that you deal with?
So in my training, and at least in my experience in the past, you're right, Dishan, where people were brought in by their family members in the past, yeah. Tetapi lately, over the last 5 years or so, I'm seeing patients come forward. And I think that what that means is that, particularly in the Klang Valley where I practice, people are probably more aware of the symptoms that we discussed just now. They are more aware about mental health in general, and therefore they're coming forward. In fact, this whole year, because of the COVID year, we know that one of the mental health issues that are at rising because of COVID is going to be anxiety and depression. People have come forward much earlier. And I think more organizations are also very sensitive towards mental health issues, and therefore we're seeing patients coming earlier than they normally would be, and therefore seeking the help that they duly reserve. But they came alone. Or in the past, yes, you'll be brought in by your family member because macam kita kata tadi lah, dah melarat 3 tahun, dah tak keluar rumah dah, takut,
Itulah.
ataupun dah tak dapat berfungsi. The majikan pun rasa macam kenapa budak ni kan, so they bring them to the hospital at that point of time. So I think when you come through that method reluctantly, it's harder for us to treat because you are not engaged in wanting to find help. Of course, after you've been explained, baru you might say, aha, that's what the problem I have. Tapi bila you dipaksa tu, it's a bit different, Dishan, from when you realize that there's something wrong with me, I don't seem to be able to function, and then you're looking for help, and you come to see Dr. Sandra first often. Often they will see Dr. Sandra first, her team.
Yeah.
And if these colleagues of ours in family medicine, general practitioner, are engaged in looking out for mental health cues, then often they will be like she said just now, they'll be assessed and then subsequently referred. And often at this point of time, these patients actually get a better outcome from their problem.
Okay. Just before we move on to the next.
The problem is, sorry Dishan, about stigma. Okay, so from a general practitioner point of view tu, okay, banyak stigma. Melarat last time 3 years, all those kind of things. We have a lot of those cases who now they are suffering quite badly. Sebab dulu tu memang dibawa oleh orang because there are a lot of professions, okay, there are a lot of even simple jobs, okay, even you work as cashier and that kind of thing, okay, it affected tau. Kalau you ada stigma, the moment somebody knows that you ada jumpa psychiatrist atau you ada macam makan ubat apa-apa berkaitan dengan mental health, okay, is it to calm you down ke ataupun ubat tidur ke, macam Dr. Amir mention tadi, adequate sleep is the main thing that everybody need to achieve. But most of us nowadays ada masalah tidur, okay, even if we sleep, it's not a fruitful sleep kita kata, okay. But right now I think it is a little bit lebih elok sikit lah masyarakat kita ni, okay, lebih open. I think it's also because of social media, okay. Dulu social media not really into all these things. Sekarang ada juga, the good thing about current is that there are celebrities, okay. Celebrities are people who a lot of followers and that kind of things. For example, I think the only person that can come to mind is like Deepika, okay, Deepika Padukone, the famous Bollywood actress. So she's top in her industry, she's beautiful, she's thriving and but then she's suffering from depression, di mana she's opening up, and by her opening up, actually I see a lot of people, even our masyarakat memang love Bollywood, okay. So they sometimes when they come to me, Dr. Deepika spoke about this dekat ni, so I datang nak check macam tu. So people are opening up, they are sharing, okay. Those who actually are public figures who have followers macam tu, masyarakat pun now a bit more accepting, okay, because those days I think about 10 years ago, if you are the youngster and then you have this problem and you know what your parents might tell you, hey, we went through worse than you, okay? And this and that and everything. What are you talking about depression? There's no such thing as depression. There's no such thing as anxiety. You tell your parents, "Mo, I rasa berdebar-debar." Ayah, nothing lah. Go drink warm water. You'll be fine. Okay? No, serious. That's what happened. Betul tak? Okay? Now we still do have it, but there are more openness to mental health issues, okay? So the stigma has reduced, and we as doctors and also as family members need to spread awareness juga, okay? Anti-stigma not just kepada diagnosis tersebut, tapi kepada perawatan juga. Okay, you might be diagnosed with anxiety, you don't take medication, okay, but you cannot stigmatize that person lah. Oh, tak payahlah bagi tahu dia benda tu, satgi dia akan tension, satgi dia stress berlebihan. We cannot. So those are all called stigma as well. So this has improved. So like Prof just now he said, okay, Dr. Amir, he said that there are like even Klang Valley, KL, people are more open. I think even like me, I'm based in Langkawi, and I do have patients who come from Kedah areas a lot also. I think they are quite more open juga. Yeah, they are willing to tell the doctor, but they do tell me, doctor, jangan bagi tahu orang lain boleh tak? And there are a lot of them who, even when I give them medication on the starting base tu kan, just to relax sikit ke apa ke, they ask me to label as something else. They are so scared. Okay, dekat rumah somebody else baca the label macam tu. Yeah, okay. This is very important. We need to go through this stigma dalam masyarakat.
Dr. Amir, I just wanted to get your thoughts. Just thinking about this family punya involvement in getting these people to come to see doctors and GPs and things like that. Let's say kan, in our participants now, there is a person who's watching who dia punya family member is, they suspect who is suffering from anxiety disorder. What are the tips that you can give them to try to talk to this person to go and seek treatment?
Well, I think first of all, we want to acknowledge the symptom that that person has. Biasanya kita akan cuba mengelak, tapi I think it's really important that we bring it up to the family member, saying that these are things that we've noticed. What do you think about them? Kalau individu tu rasa macam, oh, finally somebody has noticed these symptoms on me, and asking me about this because I also was wondering what the symptoms are, then that starts to become one conversation. Yang kedua tu, kalau individu tu tak nak, another what I say softly way of actually doing it is to leave material that they can read or they can listen to, like podcast for example, or even maybe Dr. Sandra punya TikTok yang relevant, supaya this particular person has the time in their free time to look at it and then kata, oh mungkin I do have that problem, and then reach out. I think yang penting sekali itu bahan tu kena ada, awareness tu macam Dr. Sandra kata mesti ada juga. And I think going back to your question, Dishan, about family involvement at this point of time, we are very lucky in Malaysia that our families are still very much connected. They play a huge part in providing support. Once a diagnosis is made, kebanyakan ada saya faham segelintir itu mungkin ibu bapa, kawan-kawan tak begitu supportive, tapi kebanyakan of our population is very supportive once you are told that you have a certain condition, and that support actually goes a long way in actually helping in the recovery of these individuals.
Okay, maybe we can move on to our next. I think Dr. Sandra and Dr. Amir has a few cases you guys want to share about your anxiety disorders.
Okay, probably I'll go first lah before my line
Sure.
lags. So I will say, okay, let's social anxiety. So tadi kita dah discuss a few types of anxiety, okay. So nanti Dr. Amir will share about PTSD lah. He is more into that. Okay, social anxiety I see a lot. Okay, social anxiety, and I think the quite new I actually wanted to say just now juga adalah relationship anxiety as well. Okay. Di mana with the COVID everything, the family members, everybody are together. Okay, relationship anxieties are also increasing. Okay, social anxiety. Okay, di mana for example, ada satu patient ni, every time dia ada just say family gathering, the person, okay, she's a girl, youngster, dia suka, she likes family, she likes to mingle, okay, and that kind of thing. But the thought of going for a function itself, dia akan jadi macam sesak nafas, okay. She feel like she cannot breathe, dia macam rasa macam nyawa tak lepah macam tu, okay. Then she will come to clinic first, okay. She will come to clinic first to check the lungs will be clear, dia nak check oxygen, okay. Oxygen will be normal, okay. And then the moment dia masuk, even if it's just a party of 5 people or 6 people at home, just say birthday party macam tu, the moment dia masuk, dia akan start untuk kita kata cold sweat. Okay, so dia peluh, tapi peluh sejuk kita kata, kaki dia akan mula cramp and everything. Within seconds, she will just faint. She will just faint or near fainting. Okay, so this is one of the few examples that I have for social anxiety, di mana dia tak boleh nak keluar rumah atau dia tak boleh nak bergaul walaupun dia nak. So it's mengganggulah dia punya normal life, dia tak boleh nak pergi even to college, okay, and she's enjoying her life right now because of COVID sebab online learning. Okay, so this person is actually very happy right now sebab online learning, there is no pendekatan dengan orang ataupun dengan lecturers ataupun tempat yang besar, bilik kuliah macam tu. Yeah, social anxiety. And under this week, the pandemic semua, kita ada coronaphobia juga, which we talked about.
Yes.
Okay, where you are anxious the moment you hear about Omicron, pop, gone. Cannot sleep, cannot eat, don't want to go out from the house, okay. Going with the nano spray, kita tak tahu, KKM kata tak boleh pakai nano spray, tapi dia pakai nano spray, spraykan semua orang, spraykan semua bahan yang dibeli, okay.
Yeah.
Sanitizing the hand non-stop where until ada masalah kulit, okay. Anak-anak tidak dihantar ke sekolah, okay. Grocery tak buat, nasib baik sekarang ada online lah, but not everybody is very good at online grocery shopping juga. And dia ada kadang-kadang ada limit, you kena beli this much baru dia hantar. Okay, so this is where this anxiety disorder, which is dia jadi macam satu penyakit dah, macam penyakit kencing manis darah tinggi sebab tak mendapatkan rawatan. So we don't want you to go through this kind of thing. That's why you need to assess. Macam Dr. Amir kata, bahan, that is very very good idea. That is a very good idea. Leave notes here and there. Okay, macam tu. Kalau diorang rasa when they notice they have that, okay, then they can come and seek. Now the problem is this, with the social anxiety atau with the corona phobia ataupun this pandemic, is that dia takut nak keluar rumah. What? So kalau kita tinggalkan bahan and everything, how they going to come? That is another thing where right now kita kata online consultation, kalau bukan masalah kesihatan, but this we can probably look into it jugalah. Some doctors are providing that, which is quite good untuk these patients. Once they're feeling better a bit, then they can come out and physically see the general practitioner ke ataupun KKMO untuk buat blood work semualah. Maybe we can look at PTSD from Dr. Amir, which is very very interesting dan ramai yang ada PTSD.
Yeah, Dr. Amir?
Yeah, I think so. I think that, I mean, I've got a lot of cases if you wanted to hear cases, but I think the one that probably is going to be related to some of us here, healthcare providers, I think it's very important for us to appreciate that we are at risk of developing post-traumatic stress disorder. In fact, from the research, there is an increasing number of post-traumatic stress disorder symptoms in healthcare providers over the last 1 year as we go through COVID, particularly those who are working in high risk areas because of the experience that they've gone through as a result of COVID. One of the one of the main reasons has been the traumatic experience that all of us had gone through, particularly if you're working in clinical setting in the hospital, particularly the ICU. Because at that point of time, there was a period, if you remember, that people were intubated alone. And as a result of that, with what some colleagues and friends of mine did was they actually tried to call the family prior to intubation so that the family member that is still alert at that point of time is able to communicate with the other family member. But the conversations that are normally private is now for people to hear because the doctor is the one or the nurse is the one that's actually putting the phone to the patient's ear and you can listen to the conversation. And the conversations have been, of course, very, very emotional and traumatic for certain individuals to the point that we have heard colleagues have been also crying, breaking down, just listening to the story. So as a result of that, and then of course, most of them might not get through at that point of time. This was at the height of COVID. Some of them would have gotten through. But you can imagine the trauma that colleagues are having to normally not really know the patient very well, but because of the one-to-one care, and the proximity, the close proximity, they had to be very close to this individual and then they lost them. So there's definitely going to be an impact towards my colleagues' emotions and also psyche at that point of time. So for some individuals, as a result of this, had developed almost like a post-traumatic stress disorder-like symptoms. They would have flashbacks, recurrence, they couldn't sleep, they would have anxiety coming closer to the workplace. Some of them, of course, working 24/7, long days for the whole year, not taking leave, for example, would have symptoms already suggestive of burnt out. Then you add on with these kind of experience, it can be very, very traumatic. So as a result of that, we have seen not only in Malaysia, but also in overseas, looking at the data across all healthcare providers, that the stress of the post-traumatic stress has increased. So depression is the number one mental health issue that often happens. Post-traumatic is number two, and then anxiety is number three. In terms of the frequency of people coming forward with mental health conditions as a result of COVID. You know, another issue that we are now dealing with, as we know, is going to be the flash floods.
Yeah.
So again, I predict that we're going to have some individuals that will be struggling with their emotions and probably will have traumatic experiences as a result of this present flash flood that we're having, or this flood that we're having across the nation, that is unprecedented. Most of us were unprepared for it, leaving us to be really in a different situation as if you would prepare for a flight like normal. And therefore, I suspect that we must watch for this space, because in the next 3 and 6 months, then we will really get to see whether people are, or some people are going to be struggling as a result of this. So that's one story with regards to anxiety. I think the other one that's often we need to mention as well, and I think relates to lots of people, is what we call panic disorder addiction. So panic disorder often is going to be like the typical case. The worst case scenario is a person who doesn't come out from his house because he's had these anxiety disorders, these panic attacks that are unprovoked, out of the blue, that results in him being fearful for his life. He thinks that he has a heart attack or he's going to go crazy at that point of time. Because it's unprovoked and it's unprovoked, he doesn't know when it's going to happen. So, of course, the best way for him to make sure that he's safe is to be at one place, preferably with help. So, dekat rumah lah probably, yeah. So, worst case scenario, the guy doesn't come out. The best case scenario is that he's still able to do his work, but he's always scanning. So, he's always tired looking, making sure that he doesn't suddenly have an attack. Yeah, so individuals like this are out there. So oftentimes than not, these people would have an attack, would go to the hospital, would go to the clinic. Even if they go on holiday, we'll be looking at the places to see. They'll be looking at the nearest hospital that they can go to. That's how bad it
always
can be.
Planning.
Yeah, always planning for the worst, because you don't know when they're going to have that panic attack. But I think what is more important is that these individuals, once they get the diagnosis correct, and the treatment, are often able to function. So I've got this patient who had exactly what I shared with you just now, to the point that he's unable to drive. He doesn't get a promotion because he's unable to fly. So one of the things that he needs to get promotion is he needs to travel. He refuses to travel because he doesn't know when he's going to where to find help. His family has never gone on holiday because he doesn't want to go on holiday, because he doesn't know where to find help in other places apart from his own. So you just imagine the kind of difficulty that he's having. And apart from that, more recently, he doesn't want to drive because he had a panic attack when he was driving. He almost crashed his car, so he refuses to drive. So he's very much dependent on his wife at that point of time. So, and he's been visiting the hospital and seeing many doctors, Dr. Sandra, cardiologist, gastroenterologist, respirologist. And then after repeating a few times these doctors, one of them said, I think you need to see a psychiatrist. I think the moment we got the diagnosis of panic disorder, we started him on the treatment. He's now fully functional, just got promoted, cycling in Guthrie already, literally living his life to the fullest. I met the wife. The wife now doesn't drive him already because he drives himself. And more importantly, they went on a holiday.
That is so nice to hear.
The impact of that one treatment for something that people say are untreatable is just tremendous. So we've seen a number of lives transform as a result of this. And if you talk about social anxiety, I got this really classical case where this individual, for example, in fact, one of them, she would be very anxious towards people scrutinizing them. Often social anxiety is like that. They have anxiety with people, with crowds, with people looking at them, scrutinizing them, particularly if they're eating. As a result of that, they might actually hide themselves. So like Dr. Sandra mentioned just now, sometimes they're able to still cope. In university, in colleges, like now they're able to cope because it's maybe online. Tak rasa sangat. In the past, they might be able to cope because they're behind somebody else. Okay, Dishan, you present. So whole time in university, Dishan is presenting, I'm behind Dishan. Tak apalah, I buat kerja-kerja tu tapi I tak ke depan. When do we see the problem? When you have to go to work. You can't be hiding behind Dr. Sandra when you're at work. You have to show yourself out. At this point in time, we see these individuals not able to function. So where do they go? They will often be in the night shift. They will often be taking overtime. Benda-benda yang tak ada orang tu. And this is where they go. So you're limiting your opportunity in life as a result of your social anxiety. And this is minus the fact that you're probably not going to have a girlfriend or boyfriend. You're probably not going to have natural ability to attract the opposite gender because you're anxious. So there's one individual that had these symptoms, was actually brought forward by a friend, just like you mentioned just now, because the friend felt that this person only had one friend because dia dah tak comfortable dengan orang lain. So felt that there was something wrong with this friend. We noted that he had anxiety disorder. She had social anxiety disorder. We against commence treatment. Her anxiety was very much reduced. She's uncomfortable with crowds but still able to now function in crowds. And more recently, I heard that she has a boyfriend. And more importantly than not, she's been able to work as well without much difficulties. She's still uncomfortable in crowds, but the medication that she's on allows her to be able to at least be able to redah saja the situation rather than in the past hide herself from the back, So again, treatment does help for certain individuals once they get the diagnosis correct.
Okay. So let's just move on quickly because we have some questions from our participants. Let's just quickly go to if everybody who's watching here, participants yang tengok kita hari ni, how do they actually go and seek help? What is the first thing they need to do? We go through that quickly, then we go to our participants' questions. Dr. Amir.
Well, I think now, there's various methods like Dr. Sandra had mentioned just now. Our system in Malaysia is actually very complete. If you're having these symptoms, if you want to go to the public service, kesihatan ada. If you want to go to private service, there's going to be general practitioners out there, many of them. Dan kita sistem tak discriminate. So kalau you know that you might have a problem in mental health, you can actually directly see either the public psychiatrist in the hospital or the private psychiatrist in the hospital. Kalau you tahu ada beberapa jenis pakar kesihatan mental, for example ada counsellor, ada clinical psychologist, ada doktor psychiatry, you can also access this help as well for you to at least get a first assessment. So apa beza antara doktor psychiatry dengan pakar clinical psychologist? Biasanya perbezaannya adalah doktor psychiatry ada doktor perubatan yang telah subspecialize dalam bidang psychiatry atau kesihatan mental. Yang psychologist ni lebih kepada isu kesihatan mental secara umum. Kalau counselor tu dia biasanya jadi sebagai penggalak, tetapi dia juga ada pengetahuan dengan isu kesihatan mental. So kalau mereka jumpa awak ataupun you jumpa dia dulu dan dia rasa bahawa isu yang diketarakan terlalu berat, dia akan rujuk ke atas. So dia akan pergi ke psychologist ataupun kepada doktor psychiatry. Kalau kita pun jumpa awak dan kita rasa bahawa isu ni tak sebegitu serius, kita akan refer atau rujuk ke bawah kepada clinical psychologist dan counsellor. So kita ada, those are the ways that you can actually access. Kepada mereka yang mungkin tak nak jumpa doktor dulu tetapi ada isu keresahan yang tak dapat ditangani, bolehlah call Befrienders ataupun talian kasih 15999. Juga ada bantuan untuk isu kesihatan mental. Tetapi sama juga kepada yang mendengar di sana, kalau dia rasa macam berat sangat kes ni, dia pun akan menggalakkan anda untuk berjumpa dengan pakar-pakar tertentu.
Okay, alright, thank you Dr. Amir, Dr. Sandra. Maybe we can go with the first questions from our participants. We can come up with the slide.
Okay, let's go for the slide. So we have a question daripada Encik Hayat Ilyas ya. First question to Dr. Amir. Bagaimana jika ada seorang lelaki warga emas pernah terkejut kerana pegawai immigration datang memeriksa hotel kediamannya di luar negara, tetapi pemeriksaan was uneventful, tetapi sejak itu beliau mengalami nightmares on and off sehingga mengigau hal yang sama for quite some time. Berpeluh, terjaga tengah malam, risau unprovoked. How actually should he face this situation?
Dr. Amir?
So kalau kita dengar dari segi kes yang telah dibenteng, hello, can you hear me?
Yeah, can.
Okay, we can hear you.
Yep. Ya, so kalau kita dengar dari segi kes yang telah dibentangkan tu, nampak macam dia telah mengalami trauma yang mungkin pada masa itu dia rasa diri ini dalam bahaya. Tiba-tiba ada malam-malam dia tengah tidur, orang ketuk dekat luar negara. Kalau negara-negara yang mungkin pelik-pelik sikit tu, tentunya akan menyebabkan anda rasa traumatik ataupun takut bahawa mungkin nyawa ataupun isu-isu lain akan terjejas ya. So this is the one that we talk about, sounds a lot like post-traumatic stress, di mana bila dah berbulan-bulan selepas insiden kejadian itu berlaku, masih lagi terfikir, terbayang-bayang seakan-akan berada dalam situasi yang sama sehingga tidak dapat tidur, mengigau, gelisah ya. So untuk individu tersebut, saya cadangkan supaya dia disaring oleh doktor perubatan. Satu, memastikan supaya tak ada masalah kesihatan yang lain. Tapi yang kedua, kemungkinan besar dia mengalami pasca trauma, kegelisahan ataupun post-traumatic stress disorder. Maka di sinilah rawatan yang seadanya boleh diberikan kepada rakan tersebut dan insyaAllah dapat membantu untuk mengurangkan dan insyaAllah menghilangkan simptom yang dia ada tu. So this one I think we would want to see him and bring him to seek a medical professional.
Okay, let's go. We actually have the next 3 questions from the same person, Miss Amira. So let's go with the first question. Okay, hi, I'm Amira. I'm anxiety disorder patient being diagnosed since August under medicine. What Dr. Sandra and Prof. Amir said is truth. But can anxiety attack change to panic attack because sometimes it comes without any triggers?
Without her trigger factors lah. Okay.
Yes. So biasanya anxiety attacks dengan panic attacks are interchange dari segi bahasa dia tu. I think most importantly, panic attacks, to be fair, is normal. Kalau kita dalam keadaan tertekan, stress, we sometimes can have a panic attack. Saya pun pernah mengalami panic attack juga. Tetapi yang kita risaukan tu adalah panic attack yang berlebihan ataupun panic attack yang berterusan. Dan seperti yang Amira katakan tu juga betul, di mana yang akan mengakibatkan isu adalah bila kita dapat panic attack yang berterusan, yang kita tak tahu bila dia akan datang. Maka di situ kita akan merubah tingkah laku kita untuk menangani attack yang tak tahu bila dia akan datang ni. Dan di sinilah kita tahu bahawa kalau ini berterusan sehingga tingkah laku dah berubah sampai tak dapat berfungsi, maka individu ini dikatakan mengalami masalah penyakit panik, dan bukan sahaja panic attack yang normal yang dialami oleh kebanyakan kita dalam keadaan tertekan, tak cukup tidur contohnya, ataupun mungkin ada deadline yang harus kita selesaikan.
Okay. I think we have one more question from Amira. I think we have no time already.
Macam mana nak handle atau face bila you feel underwhelming selepas you think that you are in a healing phase? Sebab ini terjadi kepada saya bila I'm okay doing healthy activities, exercise, but when something bad happens, bad results or something, I will stop doing the good thing, tak nak keluar rumah, eat without non-stop. That is the binge eating, that's why we talk about it today. Macam mana saya nak pastikan diri saya sentiasa back on track? So I think she's asking how to always make sure that I'm on track all the time.
I think, thank you very much, Amira, for this question. I think this is where the importance of prevention work comes in. Bio, psychosocial, lifestyle, spiritual. So like I said, normally the lifestyle spiritual comes under the thought of prevention. So this is where you need to have, number one, routine. Number two, you need to make sure that your sleep is adequate. Number three, that you need to make sure that you exercise regularly. Benda ni mesti berterusan. And then of course yang kelima atau keempat adalah pastikan you have adequate self-care. So self-care ni adalah apa-apa aktiviti yang you suka dilakukan untuk membantu dari segi kesihatan fizikal, mental dan social. So dia mungkin seperti contohnya you could have Sandra was discussing with me prior, something like journaling, for example. Or you can learn how to do stress management, like breathing exercises or mindfulness, for example. You could start looking back into your spirituality that you might feel is helpful for you. Ada banyak self-care activities yang boleh dilakukan, tetapi semua ini perlu istiqamah atau berterusan. They need to be continuous. Isu untuk kesihatan mental ni, terutama ni bila kita dah tahu kita ada masalah atau penyakit mental ni dan kita dah baik, we need to still invest kepada kesihatan mental kita, sama macam kita invest dengan kesihatan fizikal kita bila kita kena heart attack contohnya. When you have a heart attack, tiba-tiba you tukar pemakanan you nak pergi exercise, you pastikan tidur you okay. Sama juga dengan isu kesihatan mental. Mungkin sebelum ni kita tak jaga kesihatan mental kita, tetapi bila kita dah terkena dan kita dah pulih, maka we have to still continue to invest dengan kesihatan mental kita supaya we don't have this problem happening again. Dan biasanya normal, Amira, untuk kita ada cycle, tetapi diharapkan bahawa cycle yang negatif tu kurang daripada yang positif. Itu yang penting tu.
Okay, alright.
And Amira, you must always remember, orang yang tak ada masalah pun, nobody wakes up happy every day. Okay, macam I think few days ago I have talked about it juga. Okay, so even orang yang tak ada masalah macam Amira, macam Amira ada anxiety. Kalau orang tu tak ada anxiety pun, bila dia dapat bad result ke atau something happen, dia akan down juga. So it's absolutely normal for you to feel down. So since you like exercising, yang macam Dr. Amir kata tadi, journaling apa, you must have something yang indoor. It's okay, you must understand it's okay to feel not okay once in a while. So kalau if you need the rest, you need to stay in bed for 1 day, for 2 days, tak apa, you can do it. Tapi make sure anda, even on bed, you can do your journaling on bed. Journaling tu tak semestinya menulis. There's another journaling where there is like about pictures or scraps sahaja. You just whatever comes into your mind, you just lekat macam tu je, Ataupun colouring, There's nowadays a lot of colouring books. Something that walaupun you tengah baring, you are under your comforter macam tu, you rasa je tak nak keluar, you tak nak makan, you tak nak buat apa, but you are doing something that can help you. okay, which is positive, or even by just switching on your phone too, okay, you on YouTube ke apa ke, there's a lot of healing music, okay, that's according to frequency pun ada, ataupun piano, soft jazz, whatever that you like, you ada something positive going on pada waktu you tengah down juga. Doesn't mean when you down tu, even though you like exercise, you have to force yourself and go out. No. Make sure you have something that you can do indoor and outdoor, and always remember, not everybody is happy every day as well.
Okay. All right.
Okay. And she also asked, does people with mental illness get MC because of their illness, and how do we do some awareness that people like me will also receive MC from my doctors because my company unacceptance about MC. Okay, yeah. Now I will say from my point of view, MC, this one is very very subjective, Amira. Okay, if you are memang diagnosed, okay, and sometimes you takkan ada access to your psychiatrist all the time. Okay, you usually you will have a follow up with your doctor yang berdekatan, which is your private doctor, GP ataupun klinik kesihatan punya doktor. Okay, so diagnosed patients, kalau betul-betul at that time you ada macam trigger, okay, and it's proven, yes, we do give MCs, but the problem with the stigma, okay, company, there's no actually, I dah try look for this thing actually, but I cannot find it until today. I've been looking for it for almost a few months. Company wise, is there a black and white written that the company cannot accept MC, okay, yang mengatakan daripada mental health? Sometimes the companies come up with their own policies juga. Okay. Like you tak boleh ambil dari klinik ni, you tak boleh ambil daripada klinik itu, ataupun you tak boleh ambil kalau you ada mental health problem. But if the doctor really understands you and you are having, okay, that time a panic attack, trigger attack, we're not going to force you to go to work, and we will give you the MC. But how to deal with it, usually if panel, how to deal with it with the company is another issue. So sometimes what the psychiatrist or even I, sometimes what I do is I will write an official, because you must understand MC if you all tengok daripada kerajaan ke daripada swasta memang tak ada diagnosis. Kecuali anda minta sendiri untuk claim ataupun untuk inform your boss sebab dia adalah PNC. So how does it, to everybody, not only Amina, to everybody, how does your boss know about the mental health problem? Is it that your doctor has informed, or is it that you have informed? Is there a need for them to be informed when you are on medication and you're fully functional? So dia ada banyak step-step dia, okay? And we can actually reinforce a letter from your psychiatrist mengatakan bahawa that sometimes this person might have some triggers and she is allowed to, okay, have an MC. And if your MC is still not approved by that, then I will say you do know, right? Okay, ada labor law and all this kind of things. You have to look into it juga lah.
Okay.
Betul ke, Dr. Amir?
Yep, I'll agree with that. Yep.
Okay. All right. So thank you so much. I think we have passed time now already. Thank you so much for the questions. Thank you, Dr. Amir, Dr. Sandra. Wonderful as always. So guys, we have something up next up on link.astro.com. Kita ada tak dia punya link? Okay. So jika anda mempunyai perniagaan tergolong dalam PKS and perniagaan anda terkesan akibat COVID-19 dan PKP, anda mungkin perlukan bantuan seperti latihan peningkatan kemahiran, transformasi ke digital dan modal. So AWANI LINC bakal menganjurkan persidangan Maya reboot now pada January 2022, which is bulan depan. Okay, pelbagai aktiviti bakal diaturkan seperti kelas kemahiran, pengkongsian ilmu, informasi trend terkini untuk memulakan perniagaan, dan paling menarik is virtual shop, gerai-gerai maya yang dapat membantu para PKS memantapkan lagi perniagaan. So, next month guys, for more information, layari www.link.astro.com and get your information from there, alright? So, thank you so much. Thank you so much, Dr. Amir, and thank you so much, Dr. Sandra, as always. To all our participants, guys, please take care. I will see you in the next edition. Alright?
Yeah. Okay. Bye. Don't forget to rate 5 stars kita punya webinar, and walaupun yang tak dapat untuk tengok, please do share kita punya ni so that kita dapat spread the awareness. Okay, alright, towards this. They can watch anytime they want when they need help as well. Alright. Good night, everybody. Thank you, Dishan.
Thank you, everyone.
Dr. Amir, thank you very much for joining us today. Good night.
Good night, guys. Bye, everybody. Bye.